Hello, everyone. I'm Dr. Marty Ross, and let me change my setting here just a minute there, get that a little bit more so we're at the same level. Dr. Marty Ross, and welcome to another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease. No 2 weeks are ever the same because you create these webinars with your questions, and I am very interested to see what you have in store for me tonight. Today we finally have rain back in Seattle again. I think the last couple webinars that I've been on here with you, we've actually not had rain, but it's returned. So it probably be getting dark in here pretty soon as the clouds it gets darker out there. I am creating a recording of tonight's webinar. So if you find something interesting and you want to go back and review it again, you will be able to listen to it tomorrow morning, somewhere around 9:30 a.m. Pacific Standard Time, Seattle time. Tomorrow, I will be getting that edited version of the recording out to you, and I send you an email that has a synopsis of what we talked about with timestamps. So if you actually watch the video on YouTube tomorrow, you'll be able to see it's time-stamped to the various topics that are in the email as well too. Okay, so I see a lot of familiar names here tonight on my message board, but I also see some new names too. For those of you that are back again, I'm glad to see you're here, and I hope that you keep getting some value out of it. And I assume you do if you keep coming back. For those of you that are new, there are a couple ways to participate. One is to see what questions other people have and how we respond to those questions. I do a lot of explaining of ideas and concepts, and so there's a lot of things to learn. And often the questions of others may pertain to something that you're interested in as well too. All right. Second way is to go ahead and write a question to me, and you can do that through the chat box, which is, I believe, on the lower right-hand side of your screen. It's on the lower right-hand side of my screen, but I think it's on the lower right-hand side of your screen as well too. And you can take a look at that and write your question to me there too. I do ask that you try to keep your questions on the shorter side because this format just does not work out for long questions. Okay, so I just want to be clear about that. And let me see, is there anything else I need to say here? During the webinar, when I read questions out loud, for those of you that are in the live version, you actually get to see them on your screen, all right? Which is kind of makes it easier because you can follow along. For those of you that are in the recorded version, however, they don't show up, unfortunately. So I will be reading each of the questions out loud. So hopefully we'll all get the same information and you have some background as I respond to things too. Okay. All right. So without any further ado, let's go ahead and get started here. Hello, Heloise. Let's see. Good afternoon, Dr. Ross. Do you have any experience with NAET or frequency-specific microcurrent to support the nervous system in healing during Lyme or mold treatment? I recently found a highly recommended practitioner at Bellevue using these modalities. She was very accommodating on her initial appointment for my child, and I'm curious about your experience using these modalities. Thank you. So NAET, I forget what the N stands for. It's the name of a physician. I think it's Nambudripad, but it's allergy elimination technique. So whoever the physician's name is, and then it's allergy elimination technique. I am familiar with it. I tend to use it more for people that are having sensitivities and allergies to things. And essentially what it involves doing is it uses acupuncture points, and you can tap on certain acupuncture points to desensitize people that have developed either allergy or sensitivities to things in their environment or to substances that they take. And yeah, I have found it to be effective. Okay. In terms of frequency-specific microcurrent, I am more familiar with it as being a tool that you can use to help manage pain. I'm not clear what it would do to support the nervous system specifically, as I find it more helpful for pain issues. That doesn't mean it won't work for you. In terms of healing for Lyme and mold, if a person has developed a lot of sensitivities, possibly mast cell activation as part of their illness, I think NAET might be helpful. And if they have a lot of pain as part of their Lyme or mold treatment, I think frequency-specific microcurrents might be helpful for that as well too. Okay, all right. Good luck. Hello, Lynn. Let's see. Hi, Marty. I'm wondering if you have any thoughts about CRPS. I think my mom may be in the early stages of CRPS after a poorly placed IV in her hand that caused the hand to balloon up and create enormously pain, allodynia has continued for 2 months, also redness, swelling, and tremor. For reasons other than CRPS, she is currently taking gabapentin, curcumin, and boswellia. Do you have any suggestions for CRPS? Bear with me for a minute. I'm not recognizing your initials of CRPS. I'm going to look it up here in just a minute. Oh, okay. Yeah. Complex regional pain syndrome. I got it. All right. Let me go back here. The name says it all. Complex regional pain syndrome. Complex is the issue, and that is we don't have a full understanding of what it is, but basically people can get injury to an area. And it could be from IVs, it could be from a crush injury, but then there becomes an extreme holding and perpetuating of pain by the nervous system. That's how I kind of like to look at it, okay? And typically, we will wind up using things like anti-seizure medicines, like gabapentin, like Lyrica, to help manage pain. In terms of whether the curcumin and boswellia would help with that, I'm not sure. There also could be some benefit from using acupuncture, but I say this cautiously. There's a technique of using acupuncturists that some acupuncturists will do where they're not inserting needles directly into the limb, but rather they're just placing them on the skin to activate the acupuncture points, because you got to be careful that if you're sticking needles in something, it can make the condition worse. Okay. So unfortunately, the best we have at this point with complex regional pain syndromes is medicine management. I'd like to help manage the pain aspects of it. I also do like using acupuncture, but a non-needling type, not type of acupuncture where the needles are not inserted in the skin, but rather they're placed on the skin to activate the acupuncture points. Sometimes that can be useful as well too. Okay. All right. Good luck, Lynn. Hello, Lori. Let's see. Hi, Dr. Ross. IGeneX has confirmed I have Babesia fish positive with relapse after doxy and 6 weeks of atovaquone azithromycin. Now with night sweats, banded headaches, fatigue, air hunger, and stiffness in joints. My labs show high TSH, low normal T3, and elevated cortisol. IGeneX showed some bands of Lyme, but no confirmed Lyme. I had prior mold exposure with positive urine serum testing, but am no longer exposed. Some pretty significant levels of exposure on the majority of the molds. Doing the Trifortify Omega 3, turmeric, ATPT 360, adaptogens, probiotic, prebiotics, electrolytes, and quercetin. My questions: should I prioritize Babesia treatment or addressing residual mold burden in my case? The GI detox really hurts my head when I add a pill into the rotation. What regimen and duration do you recommend for persistent Babesia to prevent relapse? While I wait to go to a new doctor, I'm trying to hold steady with quinine and Japanese knotweed. Should I add something in for? Lori, I don't see a second part to your question here, but hold on just a minute. I'm just reading back through your data here, just a minute here. Okay. So you don't need to prioritize treating Babesia over mold toxicity. You can actually do the two at the same time. What I would say, if you're already taking binders, that's how I kind of read what you're saying here, the GI detox. I would try to find a level of binder that you can tolerate. maybe it's a half a pill, not a full pill, or maybe it's one pill once a day, that does not elicit worsening of your symptoms, right? And sometimes that's by trial and error. You're going to have to learn it. You may need to even open up your GI detox capsule and decrease it to a quarter a day. Other things that are important to make it sure that, so what happens is you're using your binders to pull toxins out. The act of moving toxins out of your body, moving toxins, can trigger cytokine surges. And as many of you know from participating in these webinars, I talk about cytokines quite a bit. But basically, whenever you have tick-borne infections, bull toxicity, long COVID, you have a situation where your immune system, your white blood cells, are overproducing cytokines. Cytokines make you hurt, make it so you can't think, disturb your sleep, interfere with your hormonal systems, etc. Okay, so most of your symptoms in tick-borne infections, bull toxicity, are coming from too many cytokines. So as part of managing cytokines and cytokine surges that can come from moving toxins out, you want to keep taking the Trifortify, which is useful at that. And if you are having lots of problems still, even taking small amounts of the binder, then you might even want to take your Trifortify glutathione and make that 1 teaspoon twice a day. And then the turmeric, I would relook at what you're doing there. So turmeric is rich in a substance called curcumin, and either turmeric or curcumin can be useful at getting inside white blood cells and limiting cytokine production. However, the problem is you need to be using a variety that has good absorption, and generic turmeric usually does not. There are some products out there that are designed for better absorption, and one of those is the Thorne product, which is called curcumin phytosome. It is essentially a liposomal curcumin, which means it's curcumin that's been microscopically wrapped in fat to increase its absorption, all right? And in sensitive people, I sometimes will even go up to 2 of the 500 milligram pills 3 times a day. But at a minimum, you should be at least on 500 milligrams 3 times a day. Now, just a word of warning here. When you read about the Thorne product, it looks like the label says 1,000 milligrams. It's actually, they say 1,000 milligrams on the front, but that's for a serving size of 2 pills. So the capsules are actually 500 milligrams, okay? All right. So just some thoughts on that, okay? But you can also then go ahead and add in your Babesia treatment. So when it comes to Babesia, you were treated too short. I just want to say that. What we find in people with chronic Babesia is that a good length of treatment to prevent relapse is going to be about 4 to 5 months. And essentially what we're trying to do is to treat you beyond the life cycle of red blood cells, one life cycle of red blood cells. So your red blood cells is where Babesia lives. It infects your red blood cells. And those red blood cells will die off, are made in your bone marrow, and then will die at about 3 to 4 months. So they live about 3 to 4 months. And for whatever reason, we find the best treatments are ones where we bathe those red blood cells so that the new ones coming out when they're hatched after 3 to 4 months are also bathed in your antimalarials, your atovaquone. And that seems to prevent them from getting reseeded again. And therefore you prevent having relapse down the road. Okay. So we just find 4 to 5 months is more of an ideal time. And you can take the atovaquone azithromycin combination along with your GI detox, meaning on the same day. You don't want to take them together. As you probably all know, when you take a binder like a GI detox, it's a binder, right? So you don't want it to bind up your other medicines. So you want to take your GI detox. I used to tell people with the GI detox or any binder that you should stop all medicines and supplements that you're taking beginning 30 minutes before you take the binder. And then you can resume taking them 1 hour later, 2 hours later. So a half hour before, stop things. And then 2 hours after you take your GI detox or whatever binder you're taking, you can resume taking things again. Regarding that timing, it is okay to eat anytime when you're on a binder, but an ideal time is 30 minutes after you take the binder. And the reason that's an ideal period of time is anytime you eat, your gallbladder contracts. And even though the liver is not good at detoxifying out these mold toxins, it does process them and move them into the gallbladder. The gallbladder is a storage container, and every time you eat, that gallbladder squeezes. So basically, your binder, cholestyramine, GI detox, will make its way down south about 30 minutes and be at the place where the gallbladder releases about 30 minutes after you take it. Okay. All right. So that's why we want to do it that way. Okay. And in terms of things you might take if you're in a holding pattern for the Babesia, so Cryptolepis is my favorite herb for managing Babesia. It also is quite effective against Borrelia and Bartonella as well. And for Borrelia and Bartonella, we have laboratory evidence that it's useful at treating growing and hibernating or persister. Okay. When I'm using Cryptolepis for Babesia, I dose pretty heavily. And I usually like to have people work up to a teaspoonful 3 times a day using a 1 to 5 tincture. 1 to 5 means the tincture is an alcohol-based tincture for which 1 part of plant was put in 5 parts of alcohol. Okay. And my favorite product for that is a Montana Pharmacy product. It is just pure Cryptolepis. They do a good job making their product. And for that, you want to eventually work up to a teaspoon 3 times a day, but I wouldn't start there. I would start at a half teaspoonful 3 times a day. And if you are tolerating it after a week, not having a lot of herxing from it, then I would go up to a teaspoonful 3 times a day. Additionally, if it's going to take some time for you to get in to see a new provider, you can strengthen that Cryptolepis for Babesia by also being on artemisinin. But I would not start artemisinin until you are stable on the 1 teaspoonful 3 times a day of the Cryptolepis, okay? And the artemisinin is one of those rare herbal antimicrobial or prescription or herbal antimicrobial that I'll pulse. And the reason you pulse it is if you use it too many days in a row, your liver develops enzymes that deactivate it, right? So what we know from the Chinese actually, and their use of it against malaria, is that if you use it at high doses for 3 days, and then you have somebody stop for about 11 days, those enzymes that the liver makes die down. And during the 3 days you take it, then the drug can be very active, okay? So for artemisinin, the way I like to do that is it's a 100 milligram pill. And I like to have people take a 200 milligrams 3 times a day for 3 days in a row, and then be off for 11 days. At the next round, if the first round did not give you lots of air hunger, night sweats, or make you really fatigued, then I'll have a person go up to 300 milligrams 3 times a day. Again, 3 days on, 11 days off. If they tolerate that, fine, then up to 400, and then eventually up to 500 milligrams 3 times a day for 3 days on, 11 days off, and you just keep cycling that way, okay? Now, a Herxheimer reaction, a Babesia Herxheimer reaction, die-off reaction, usually can occur up to 5 days after you take that first artemisinin, okay? Just want to make you aware of that, all right? And what a Babesia Herx looks like usually is worsened fatigue, night sweats, or air hunger. Even if you haven't had air hunger or night sweats before, it can happen, okay? All right. And usually it's going to be up to about day 5 of that artemisinin when you're going to get it, okay? All right. I hope that gives you some insights, and good luck to you. Hello, Joan. Hold on here for a minute. These glasses just keep sliding down my nose. I feel like I'm going to spending the whole night just pushing them up here if I'm not careful there. Hopefully that's going to hold them a little bit better. All right. Hello, Dr. Ross. Questions about the RealTime Lab urine test for mycotoxins report. When the levels are below the blue line, the mycotoxin is reported as not present. I don't quite understand this. Should the levels be 0 to be not present? After the test is negative and taking itraconazole for 6 months, are supplements advised or recommended going forward? And 3, when in remission from the triple Bs, Are there supplements recommended for maintenance? Thank you. All right. So regarding the RealTime Labs, I find that I think it is, in my clinical experience, I'm just reflecting my clinical experience, RealTime Labs will report 0 and indeterminate, and then they'll produce something that says it's not indeterminate, it's actually elevated. I find benefit in treating any levels that are in the equivocal to high range. Okay, so the 2 bands, one is equivocal and then the other one is you clearly have it in you. That's what I find benefit from treating. My goal has never been with my patients to necessarily get them to 0, but I want them out of the intermediate range or equivocal range into that other range that's there. Okay, I hope that answers your question for you. All right, so then in terms of maintenance after you get rid of your mold toxin illness, so it all depends on the person. So if you are very confident that you are living in a clean environment that doesn't have mold that's poisoning you anymore, you often don't need to take anything anymore. There are some people, though, that have regular mold exposures that it is beneficial to stay on a lower dose of a binder to keep up with what's coming in. So, for instance, if it's a GI detox you did, and it was 2 capsules a day that got you well, then you might want to go 1 capsule a day. Okay. Now, I have one of my first mold toxin patients I ever treated is a lovely Canadian woman that was the first person I ever tried cholestyramine on, and she got great benefits. It was an amazing story. She had basically gotten Lyme while doing missionary work in Africa. There was a tick bite, a known tick bite attached, bullseye rash, severe pain, could not think, severe fatigue, etc. It looked like classic Lyme. And after doing 1.5 years of antibiotics with her, we only got about 15% better. And so this was around the time that I was learning about Dr. Shoemaker's work. And I said to her, why don't we just try this cholestyramine in case maybe got mold toxins? And she did cholestyramine 3 times a day. I would never start that way these days, but I started her at 3 times a day. She tolerated it. And within 3 weeks, she was practically back to normal with her health. All right. What we discovered with her is that in retrospect, when she was doing her missionary work in New Zealand, not only did she have tick exposures, the building she was living in had black mold all over the walls. And I just didn't know to look for that back then, but obviously I do now. What is interesting, the reason I raise her story is what she does, and I hear from her periodically, she's doing very well, but periodically she starts feeling a little, quote unquote, moldy again, meaning a little achy, a little fatigued. And what she'll wind up doing is take her binders for about a week and then be back on her way. And she has to do that about once a year. At least the last time I talked to her about it, it was about once a year. She'll just start feeling that way and she'll add in her binders at that time. Okay. So how you keep up with maybe coming at you in the environment depends on how clean you think your environment is. If it seems pretty clean, meaning your home has been taken care of, you're not currently sitting in an environment that has a lot of mold toxins in it, you may not need to be on anything. But if you start getting symptomatic, then you start at that time, and you might even consider doing a short burst like my Canadian patient did at one time. Okay. All right. Then when it comes to, do you need to do anything preventive to keep the Bartonella, Borrelia, Babesia from coming back? Maybe, maybe not. I wish I had exact answers for you here. The problem is with tick-borne infections is we don't have any testing that we can look at that says, aha, that germ is 100% gone. There is no done test. Okay. When I talked to my colleagues, and we had a forum discussion about this a number of years ago, maybe a few years ago now at iLads, an online discussion about how do you know when somebody is well. And I think most of us came to a conclusion that if somebody we had treated got well from tick-borne infections, was asymptomatic from those infections for 2 years, most of us had an opinion, and I say that word opinion, that we probably had cured these people. We had eradicated the germs, okay? It was an opinion. Because most of us in those situations barely ever saw somebody coming back and relapsing again, okay? All right, so one thing about getting over Borrelia or Babesia or Bartonella, the best we may be doing for a lot of people is knocking their germ load down to a level where the immune system can step in and keep it under control. But as I said, there are some people we probably do cure. We just don't have a test for it. So what I like to do in my practice is, if it's the first time I've treated somebody and we get them well, I generally do not recommend being on maintenance herbal or prescription antibiotics to prevent relapse. The reason I don't recommend it is you have to realize that there is a risk in using your herbal or prescription antibiotics, and that is you may be disturbing your healthy gut microbiome, right? And your healthy gut microbiome, all those bacteria in your gut and the foods they digest, creates chemicals that has the gut microbiome supporting a healthy immune system. And ultimately, to prevent relapse, you want a healthy immune system. So for many people, I don't think it makes sense to put them on herbal or prescription antibiotics to prevent infection, because that might interfere with the gut's ability to support the immune system to keep things under control, okay? However, if I do get a patient that gets well and then does have a true relapse, once we get them well again, then I do like to talk about, should we be doing something preventive? And these days, I tend to go more preventive with lower doses of herbal antibiotics. And I choose those over prescription antibiotics because they have less risk of harming the intestinal microbiome, okay? So it depends on which germs you're trying to prevent. But generally, if you were to look at the doses I recommend for Cryptolepis or Japanese knotweed on full treatment, you might take those doses down to a quarter or one half as a preventive treatment. Okay, there's no clear science on what's the best way to do it, but that's generally what I'll do. All right. The other thing I want to let you know, when you do get somebody well, when they relapse, it's not going back into the 2-3 year hole that many of you find yourselves in terms of getting well. Often when you do get a person well and they relapse, they're really at a different starting point. They may feel like crap, but their germ load is at a different place. Their immune systems are more functional from having gotten over it. And generally, you can turn somebody around within 2, 4, 6 months. You can be back on your way again. Okay? All right. Good luck, Joe. Thanks for the question. Hello, Joyce. Let's see. I've been taking Cryptolepis and 40 drops and Japanese knotweed 30 drops for long-term Lyme over 25 years, as it seems to keep symptoms at bay several years now. Over the past few months, I have been experiencing an unbearable itch on my back, predominantly up and down my spine, although I have no symptoms of yeast overgrowth. I have been following an anti-candida diet since January 1. I have explored every food, laundry detergent, body care products, you can name it. The weird thing is it starts about an hour after I take the crypto and Japanese knotweed and can last for several hours, and it feels like I'm being bitten alive from the inside out. I have never heard anyone mention this. As an aside, several years ago, a doctor had put me on an oil, 1 drop behind each ear for Lyme. I don't remember the name. And this itch is similar creepy feeling as back then. I really hope you can offer direction. Thanks as always, Joyce. One thought, and I don't know if this will pertain. I do hear what you're saying here. What I read there is that there seems to be some temporal time relationship between getting the itching on your spine and in the back that corresponds with the taking of the herbs. I heard that. Okay, I want to be clear about that. But one thing I will let you know is that dry skin can be itchy skin. That's something I learned when I was just being a primary care doctor doing family medicine. One of the solutions to people that come in with itchy skin is to just look at it and say, does this look dry? And if it does look dry, working with moisturizers can make a big difference for itchy skin. So I don't get the benefit of being able to stare at your skin and figure out if it looks too dry or not. But if there's some sense that you may have dry skin in the back, because that's a hard area to even put your body lotions in on yourself, right? But if you haven't been able to do good moisturizing up and down your spine, you might want to start there. And you could get any type of moisturizer to be fine. But you want to get something that might really moisturize that area well. Give it a try for a week and see if it makes a difference for you. Okay, all right. Now, if it isn't from dry skin, why this is happening on the crypto and Japanese knotweed, I don't know. And it could even be some kind of a side effect. And what you might do is try using only one and see if you can identify which one seems to be more under this. But before doing that, again, I would try to lubricate, moisturize your skin really well up and down your spine. See what that does first for about a week. And if it's not making much of a difference, then you might want to try to start and stop the crypto and the knotweed and see which one might be under this for you. Okay? All right. Good luck to you, Joyce. Hello, Sally. Let's see. I'm curious if you have worked with a Lyme patient who only took the Liposomal Clove Oregano product and got into remission from 3 Bs. A friend gave me 10 capsules of this product, and it is powerful. I have not. I mean, it's possible. I mean, so the Liposomal Clove Oregano has actually got 3 herbal antibiotics in it, right? So cinnamon, clove, and oregano. And we know from experiments at Johns Hopkins University years ago that each of these oils independently can be effective against Bartonella and can be effective against Borrelia, treating both growing and persister forms of those germs, or killing growing and persister forms of those germs. The clove seems to have benefit against Babesia, but I wouldn't call it the strongest Babesia killer in the world. Okay, I think there's stronger things you can use. And then the 3 of them together also deal with another problem that you can get with tick-borne infection, especially, I should say not Babesia, but with Borrelia and Bartonella, you can get into situations where you have biofilm, which is a sugar slime layer that covers the germ and blocks out your immune system and can block out herbal or prescription antibiotics. And these oils help break down the biofilm, right? So maybe somebody could get well just on those alone. I haven't ever tried it that way, so I can't reflect to you whether it actually does. Okay? All right. Good luck, Sally. Hello, Sarah. Hi, and thanks for making time today. You're welcome. My question is about testing. I tested positive and treated for Lyme Bartonella 5 years ago, but issues with my legs and feet never completely went away. Now the symptoms have grown and I'm treating for Bart again: numbness, tingling, pressure, cold, hot, sensitivity, leg muscles are abruptly tight. I'm inclined to retest with a broad IGeneX panel to make sure we're targeting the right thing, but will the test be accurate if I've been treating for months? Is there some other condition I should be testing for besides vector-borne infection? Let me just see here. Okay, so regarding the previous testing you had done, so there's 2, when we look at testing, testing can fall into 2 categories. There's a category called direct testing, and there's another category called indirect testing, okay? Indirect testing basically is measuring the immune reaction to see if the immune system has reacted against an infection. An immune reaction, though, doesn't prove the germ is in you. We don't actually get to see it, but we assume it must be in you if you have an immune reaction, okay? So your The immune test that you can do would be antibody testing, which would be Western blots, immunoblots, IFA, or you could be doing ELISpot testing, which measures do your T cells remember attacking a germ that we're testing it for. Okay, so those are indirect tests. Direct testing would be a FISH test microscope test, or a T-lab FISH test microscope test, or PCR testing, which is DNA testing for the germs. Now, your direct test methods, although have great meaning if they come back positive, the problem with direct testing is it may not be as sensitive or as good at finding infection, especially when it comes to Borrelia and Bartonella, because those germs don't readily live in the blood. And when you stick your needle in, draw the blood, it just may not be in that sample that you pulled out. Okay, all right. The indirect test, especially the immunoblot methods through IGeneX, have the greatest sensitivity, the greatest ability to find evidence of those infections. And that is, it looks at for antibodies for IgM or IgG antibodies, all right? Now, the problem with the antibody testing is if it was positive before, it may still be even if the germs are gone. So I want to be clear about that. Antibody testing, if you go in and redo your immunoblots, Western blots, and they still come back positive, that doesn't give you any new information. They could still be positive from the old infection, okay? All right. So if you were to test anything, you might look at doing FISH testing or T-lab microscope exams for Bartonella, Borrelia, Babesia, or you could just look at the symptoms and make an assumption based on what the symptoms tell you. The problem with, again, the T-lab and FISH testing that's done by IGeneX, as well as the T-lab testing, is negative does not exclude having it. Positive means you definitely do have it, though. Okay, all right. Here's what I do in situations like this. This is something I've learned from doing this long enough and many times enough. Whenever somebody gets well and then they come back with what's looking like a relapse, about 80% of the time, it is not a relapse due to the tick-borne infections. About 80% of the time, it's because you develop too many yeast in the intestines, and those yeast trigger excess cytokines in the body, and those yeast release neurotoxins, which can give you symptoms that look very much, so the combination of neurotoxins and excess cytokines can give you symptoms that look like your Bartonella is active, or that look like your Borrelia got active, even that your Babesia got active, okay? So I try to figure out if it might be too many yeast. And if somebody has too many yeast, I go after that first. Okay, so here's things that make you think about too many yeast. So first of all, there's not a good stool test that proves you have too many yeast, because what we're really wanting to know is, for you, do you relatively have too many yeast? All right, all of us have yeast that live in our intestines. And by yeast, I mean candida, okay? But the issue is it more than you're used to? And even if you do a stool test for yeast, that may give you some kind of a quantity. That doesn't mean it's a problem for you, because we all have yeast that live there, right? So what I like to do, I don't rely on the test. I just ask a few simple screening questions. One is, do you feel worse if you have sugar or carbs? Okay. If you do, that can be a sign of intestinal yeast. If you feed them and you feel worse, it could be a sign of intestinal yeast. Number two, do you have increased gassiness or bloating? Number three, do you have sugar cravings? Number four, do you have worsened pimples, acne, or eczema, or new skin rashes? Whenever you have, and what happens there is if you have too many yeast in your intestines, the immune reaction that gets created can result in pimples, acne, and et cetera. Okay, all right. And then finally, if you're a woman, are you been having problems with repeat vaginal infections, vaginal yeast infections as well too? Those will be the big things I consider. And if somebody says yes to a number of those, then I assume this looks like intestinal yeast, we're going to go after it. The other thing that would make me think about intestinal yeast is if this is a person that started having a decline after they binged on Christmas cookies or cake at their birthday, some kind of big sugar source, and within a week or so of having all that sugar, they started getting worse, then I would wonder about intestinal yeast. And then finally, I would think about intestinal yeast if somebody had been on antibiotics for a tooth infection or a bladder infection. Within weeks, they started developing symptoms that look like a return of their tick-borne infections. I would wonder about intestinal yeast in those situations as well, too. Okay? All right. And the reason I would wonder about that is if you're on antibiotics, it's going to increase the chances of getting too many yeast in your intestines. Okay? All right. So I'm going to do a screen share here. I haven't done one tonight, and I'm feeling a little shaky from not doing one, so I need to do a screen share here. All right. So this is my information site, Treat Lyme by Marty Ross MD. Take a look in my Lymology guides and look in my yeast section here. And then to figure out if you have too many yeast, you could look more in depth at this problem, at this article called A Silent Problem Is It Yeast? Okay. And then in this article called Manage a Therapy Crash in Tick-Borne Diseases, this is where I make the argument that 80% of the time when you worsen, it's too many yeast in the intestines. I have a whole article about that. Okay. I think I maybe even had another one. Oh, but if you do have yeast and you want to know what to do, here is my article called Kills and Prevents Yeast, a Brief Guide. Okay. All right. All right. Good luck to you. Hello, Dave. Let's see, are you familiar with spiral upward botanical treatments? No, I haven't heard of them before. I'll have to look into that. Sorry about that. Deborah says, hi, Dr. Ross. Hello, Deborah. Hello, Paula. Hello, Dr. Ross. What supplements can be used to get rid of mold while treating Lyme? So I kind of alluded, I think I partly talked about this earlier, but you can treat your tick-borne infections at the same time you're trying to get rid of mold. And when we talk about getting rid of mold, I want to be clear what I mean by it, which may be a little different than what you mean by it or some of my colleagues do. So when you have mold, for most people, it is a problem of mold toxins being trapped in you and nothing more. All right. Now, I know there are a lot of my colleagues out there that like to right away put somebody on antifungals to kill for possible mold spores living in your nose or living in your intestines that produce mold toxins. But for 80% of the people in my practice in Seattle, Washington, where we have tons of mold, it is not a mold colonization issue. All right. And for 80% of people, what the issue is that you've got mold toxins trapped in you because your immune system won't break them down. And because the immune system doesn't break them down, they get processed by the liver and they cannot be turned into a water-soluble toxin. So they get moved out into the intestines, and out in the intestines, because they're still a fat-soluble toxin, they get reabsorbed right back into the bloodstream. So you have a swimming pool of toxins that just keeps recirculating, which has nothing to do with mold spores colonizing your nose or your intestines, all right? And so my approach generally is to put people on binders for at least 4 to 6 months and then go back in and retest my urine mycotoxin testing through RealTime or Mosaic. And if we're 4 to 6 months out and a person is not feeling better, and if their mold toxin studies look worse, then I think there is that gives us some reason to think that maybe these people are colonized. And at that point, you ought to get on something to start killing your mold spores up here and in your intestines, okay? But I want to be very clear. I know Dr. Campbell and his My Myco lab says it has a protocol where everyone should be on mold antifungals right away. I just strongly disagree with that. And also, I know from talking with people like Dr. Nathan, Dr. Krista, they would hold a similar opinion to what I do too, okay? So you don't need to go with your mold spore killers right away. All right. So having said that, what I would focus on is being on a binder, something to grab hold of those toxins in your intestines. And the binder that I'd like to start with is a product made by Biocidin Botanicals, which is called GI Detox Plus. And it has a number of components in it that can deal with a variety of types of mold toxins. So it's got activated charcoal, it's got some clay in it, it has humic acid, fulvic acid, I think it's got some silica in it as well too. It's just a good product, a general binder, okay? And you would want to start at 1 pill a day. And if you can, over time, you might want to work up to 2 pills 1 time a day. As I said earlier today, there's a timing issue with it, which is you want to make sure that you're not taking any other medicines or supplements near it, because it's a binder and it will bind them up. All right. So you want to stop all medicines and supplements beginning 30 minutes before you take your binder, and then you can resume taking them 2 hours later. And then again, eat a small amount of something about 30 minutes after you take it. Okay. All right. Let me just show you that product I was talking about. And I'm going to show you an article on how to manage them too. Let's see here. All right. So for my article about mold toxicity, you can take a look in my guides, look under detoxification. And here is my article about mold toxicity. Okay. And in here, I talk to you about how to use binders, etc. All right. And then in terms of binders that I recommend for this, if you take a look here in my supplement section here, and you would want to look under detoxification. And this is the GI detox that I was just talking about. Okay. All right. And then these days, again, I'm working with a partner in terms of selling supplements. And so when you click on this button here, you're going to be brought over to my partner, which is Femologists. They're great people. I like working with them. They've simplified my life by having them do this for me. I still have my detailed product descriptions here, which are a little deeper than theirs. But in terms of processing, handling the products, they do a great job. And so if you were to click here, you'll be brought over to the Femologist website. And this is my trusted partner. Okay. All right. Let me go back here again. Oops, I guess I didn't. Oh, there we go. Got it. All right. Good luck, Paul. Hello, Mira. Let's see. Go back here. Do you taper off antibiotics, minocycline, or rifampin after 6 months of Lyme and Bartonella treatment? Or can you stop at once? Still taking herbals, biofilm busters, detox, immune support. Thank you. So if your treatment is complete, you can stop all at once. Let me tell you what I mean by complete. All right. So generally, my goal when I decide I'm going to stop or recommend stopping either herbal or prescription antibiotics, there's 2 conditions I like to look at. One, if I've treated somebody and they got 100% well, I want them 100% well for 1 to 2 months before we stop the antibiotics. The reason I do that is I find less chance of getting into relapse. Okay. All right. So 1 to 2 months is what I like to do. Okay. All right. The other just the way that I'll decide it's time to stop is if I've worked with somebody and I've gotten them to a pretty good place, and we keep trying a variety of different ideas I have to try to move their treatment forward, and we just can't, and they're kind of plateaued at about 4 months without major changes for 4 months. Those are situations where I will also consider stopping the antibiotics. And again, you can do that cold turkey. Okay. All right. Good luck. Hello, Dave. Let's see. Are IV treatments using Argentin a viable way of removing Lyme? I know that the makers of Argentin claim that they can cure Lyme, or they make these what I call very false claims. And I have never seen Argentin be a viable way of getting somebody over this infection, unfortunately. The other thing to be aware of with colloidal silver in general is that there is a lifetime maximum that you can take colloidal silver. And if you take over a certain level over time, it can turn your skin blue, permanently blue. So I don't like messing with colloidal silver, and I don't agree with the people that sell Argent and the various claims that they make on that. Okay? All right. Good luck, Dave. Hello, Margaret. Hold on here just a minute. What evidence can I give someone that proves that chronic Lyme exists? In other words, after the 6 months or so a person has received antibiotics, some doctors are adamant that it doesn't exist after this time period. Well, that's just not true. I am going to look at something here real quick, and you guys are still going to see me, but there's Dr. Ralph Stricker just published an article sometime in the last 2 or 3 months where he went through the science showing that Lyme can live on through antibiotics. There's a lot of science on it, actually. So bear with me here. I'm going to find it for you. All right. I wonder how we can. Okay, I'm going to show you where you can find this or read about it. So let me do a screen share here. Okay. So this is an article that you can find at lymedisease.org where they write about the article that Dr. Stricker just published in this journal called Advances in Infectious Diseases. Okay. But I would take a look at this article. They talk about it here, but there's tons of evidence. In fact, here's a chart where they're showing you all of the various science that shows that it can live on. Okay. There's a lot of science about this. Okay. And but you can find the article here, and the URL is lymedisease.org. And then if you look up here, it says Lyme-can-persist. Okay. That's where you can find about the Stricker article. Okay. All right. All right. Good luck, Margaret. Hello, Darla. With Morgellons, how do you get rid of the slime draining from the sinuses down my throat? Please, so grateful for any help. I feel like I'm dying. All right. So Morgellons, many of you may know, is a skin condition that people have that can give a lot of breakdown of the skin, can give itching. And sometimes, often people will have fibers and filaments that come out of these lesions too. And when we look at studies, when we scrape these things or we take biopsies, we don't see any active infection like parasite infections or anything living in them that would explain the breakdown. What we do see is that about 90 to 95% of people with Morgellons will test positive for one of the 3 big tick-borne infections, especially Borrelia. And so many of us that treat these conditions assume it is a skin manifestation of tick-borne infections, okay? What we often see with it is if we just focus on killing the tick-borne infections and doing everything that we need to support the body that we would for any person living with tick-borne infections, that the skin manifestations will get better over time. All right. So that means making sure that people get good 7 to 9 hours of sleep a night, supporting the adrenal glands with things like ashwagandha, working on inflammation, like I suggest people do with the curcumin, possibly with quercetin, being on a good anti-inflammatory diet. And these days I prefer to use plants or a plant-forward diet to do that. Making sure you're treating your tick-borne infections. But the big one is getting intestinal yeast under control. All right. Now, the reason I raise intestinal yeast is intestinal yeast will cause Morgellons symptoms to get worse. And intestinal yeast can trigger the mast cells that line your intestines to be reactive, releasing histamines that result in drainage up here going down your throat. So one thing I would make sure that you've done, or that I do in situations like this with my patients, is to deal with intestinal yeast overgrowth as part of managing this condition. Prescriptively, I like to deal with nystatin, 500,000 international units twice a day, and couple that with fluconazole, which is also known as diflucan, 200 milligrams one time a day. That's one way to go about doing it. Usually that's going to clear a person up pretty good within about 30 to 60 days. And in fact, I just talked to a Canadian patient of mine that had come in to see me with really bad Morgellons 2 months ago, and severe Lyme, severe tick-borne infections, mold toxicity issues. And one of the big things we did between now and the last time I saw him 2 months ago was a diflucan nystatin protocol. And his skin is very much nearing being resolved. It made that much of a difference for him just going after the yeast. Okay, so I want to be clear, it can be a big deal to do that, right? If you're not able to get the nystatin or the diflucan, then the other option would be to go herbal on yeast. And what I like using for that from an herbal standpoint is I like using a product by Karuna. That's Karuna. The product is called Capri Plus, Capri Plus, which is a mixture of caprylic acid, garlic, and oregano oil. And I find that helpful in managing yeast overgrowth in the intestines as well, too. That's a couple pills 2 times a day, but you're going to need to give it about 2 to 3 months to make a difference for you as well, too. Okay? All right. So those are just some thoughts for you. And then if you are looking for an article about Morgellons, for those of you that aren't familiar with Morgellons, want to know more about it, let's go here. So this is an article that I had about Morgellons. You can take a look at this here. Okay. All right. Good luck, Darla. Hello, Dave. Is tirzepatide a potential to reduce Lyme inflammation? It's a great question. I think tirzepatide, everyone, is one of the GLP-1 drugs, like semaglutide is, that is being used for both diabetes and weight loss management. And we're still trying to understand the full ramification of these drugs. So it's a GLP-1 receptor agonist, and we have GLP-1 receptors throughout the body, even in the immune system, the gut, it's everywhere. Okay. In terms of how it helps with weight loss and diabetes management, these drugs cause the pancreas to release insulin more easily. They also make it so that your satiety centers in the brain feel like you're full more quickly. They turn off a lot of the food chatter that goes on in your brain, and even addiction chatter. We're finding it helpful for people with addictions, for instance, as well, too. And then they also slow down your gut emptying so that you fill up more fast, and therefore you feel full more quickly. So you wind up becoming calorie restricted because your brain says don't eat, and because your gut just doesn't move the food out more quickly. Okay. Now, keep in mind, so there are some people that I know are seeing less inflammation while they're on tirzepatide or semaglutide. It's not clear to me yet, based on the science, that this has anything to do with decreasing Lyme inflammation or tick-borne infection inflammation. And let me explain. I'm not denying they don't feel better and they have less inflammation. One of the things that we could be seeing, though, is when you have prediabetes, or you have diabetes, or if you have weight excess, those conditions are inflammatory. So with prediabetes or diabetes, it's not just that you have elevated sugar and you get into blood vessel damage from that. It's also that elevated sugar leads to inflammation in the body, okay? Obesity, when people have extra weight or they're overweight or they're flat out obese, fat releases excess inflammation chemicals and cytokines too. So by the nature of prediabetes, diabetes, and being overweight, you have an inflammatory state in the body. So it's possible that when people with tick-borne infections are reporting decreased inflammation on a tirzepatide or on a semaglutide, it may have nothing to do with Lyme immune system inflammation, but rather from sugar or obesity inflammation that's getting under better control, okay? Now, I know there are some of my colleagues that are trying to use these at low doses to see if they get some benefit on inflammation of people with tick-borne illnesses. Maybe it makes a difference or not, but I think it's hard to, we would need to see some good studies that look at sugar levels and weight. And so I think if we could get a study done where people that started tirzepatide or semaglutide did it, and they started out with no elevations of sugar and they were not overweight, and then we could see their inflammation get better, that would give us some indication that maybe there is an anti-inflammatory effect from a tirzepatide and semaglutide that helps with inflammation caused by tick-borne infections. But I don't know if we know that. We don't have that kind of data at this point. Okay. All right. Good luck to you, Dave. Hello, Lynn. Let's see. Last week, you confirmed my positive Babesia microcurrent fish and IgM, which likely explains the cyclical pattern I've experienced for years. Debilitating fatigue that surfaces 6 to 8 weeks after any immune stressor, whether a virus or an environmental trigger, as though it awakens a dormant infection. You recommend treating the Babesia but do not specify a protocol. My current doctor has prescribed Mepron and antibiotics, and when I asked about herbal options, he mentioned Cryptolepis, artemisinin, Japanese knotweed, and cat's claw. Could you share which of these you would prioritize and what combination and at what doses for Babesia microcurrent specifically? You also mentioned either reishi mushrooms or peptides for immune support, but did not include dosing. Which do you prefer and why? Are there supportive supplements you routinely recommend alongside treatments such as liposomal glutathione? Finally, any experience with UVB or with or without ozone for Babesia, as well as HBOT? Many thanks. All right, that's a lot of stuff there. I'll try to get into all of it here with you. All right, so when it comes to Babesia, in terms of herbal protocol that I would go with, I know your doctor recommended a number of things here, but of the herbs that you mentioned here, the crypto, artemisinin, knotweed, cat's claw. Knotweed and cat's claw do not have anything to do with Babesia. They don't kill Babesia, okay? Now, if your doctor thinks you might have Borrelia, they can help with that. They might even help with Bartonella, at least the Japanese knotweed would. Cat's claw is just Borrelia, all right? So I wouldn't use those if your main thinking is you want to target Babesia, okay? So for Babesia, I mentioned this earlier tonight, but again, I would use Cryptolepis, and I would try to work people up to a teaspoonful 3 times a day. And you could add in artemisinin to that. And again, I would listen back earlier tonight, I gave a whole explanation about how to use artemisinin. Basically, you want to start at about 200 milligrams 3 times a day, taken for 3 days, and then off for 11. And every 2 weeks, when you redose it again, if you can handle an increased dose, you want to add 100 milligrams per dose. So you would start at 200 milligrams a day for 3 days, 200 milligrams 3 times a day for 3 days in a row, 11 days off. The next round, you would go to 300 milligrams 3 times a day for 3 days on, off for 11 days. And as you can, you try to work up to 500 milligrams 3 times a day for 3 days on, 11 days off. Okay. All right. And then in terms of immune support these days, so you could do reishi mushrooms, which are very useful at boosting the immune system. I usually like to go about 400 milligrams 3 times a day on that. or I like working with a peptide product through integrative peptides, which is called Thymogen Alpha 1. And that would be one pill 2 times a day. And I believe I'd have to look at the dose, but the Thymogen Alpha 1 is a bioregulator complex. And so it's got short strand, 2 peptides in it. I think it's thymosin alpha 1. I forget what the second one is, but these are short, like I think 3 amino acid strains of each that get the thymus gland, which is here in your chest, to work more effectively. In adults, it doesn't work that well anyhow, but to turn that on so that the thymus can direct the immune system to be more active, okay? And so of that product, the Thymogen Alpha 1 through integrated peptides, it's 1 pill 2 times a day. Other things to look at would be to look at my Lyme disease protocol and do key components of that. So I'm going to show that to you here. Okay, so this is the Ross protocol here. And all of these areas over here on the left side, like sleep, all the way through Lyme infection, Babesia infection, each one of these is a key component to helping you get well, all right? Because tick-borne infections mess up your sleep. And so you want to get 7 to 9 hours of sleep. Tick-borne infections create inflammation. And so I generally like using a Mediterranean type diet can be helpful. There's also a diet. This diet here is useful to support mitochondria, but either one of these can be helpful. All right. I like making sure that we keep the intestinal microbiome in healthy shape. And I talked to you about how to do that here. At a minimum, I would try to be on a probiotic. And the one, you got a few options, but I mentioned them here. Okay. If you can do exercise, I would do it to tolerance. Don't do something that knocks you down the next day. You want to control cytokines, and my favorite anti-cytokine agent is curcumin. Specifically like that thorn curcumin phytosome, 500 milligrams 3 times a day. I like to have people on an adaptogen, which is an herb that supports the immune system, thyroid, and adrenal glands. And for that, I like ashwagandha. And I do as a 400 milligram pill. And I like people to take it as 2 pills in the morning and 2 pills between 1 and 2. I like to make sure that all hormones are balanced. And although I focus on adrenal and thyroid in this section, I also, in females, want to make sure their estrogen, progesterone, and even testosterone is okay after they enter the perimenopause or menopausal phase. I like people to be on a good multi, and the multivitamin I like using is a multi by research nutritionals called Physicians Daily, and that would be 3 pills 1 time a day on that. For detoxification, I would like people to be on, I don't really have people take anything at the beginning. Immune boosters, well, you're boosting your immune system by getting sleep, knocking cytokines down, and balancing your hormones. That's essentially what immune boosters are. If you have yeast in you, knock those out. And then finally, work on treating your Babesia infection. Okay? All right. So take a look at this in more detail. That tells you the key things I think are important in anybody's tick-borne infection treatment. All right. And then let's see here. So generally, when it comes to UVB, UVA, ozone, HBOT for Babesia, I don't find it helpful. And I think part of the problem is oxygen. Babesia thrives in oxygen. It lives in your red blood cells, right in the middle of it's getting oxygen. So I don't find them to be helpful. Okay. All right. Good luck, Lynn. Oh, for those of you that are wondering about the, I'm going to do another screen share here. Okay. So regarding the peptide product I was telling you about, it's called Thymogen Alpha 1. And this is the product right here. I have a relationship with integrative peptides. If you're new to them and you use this coupon code MartyRossMD.com, you'll get 10% off at checkout. Okay, that's for new people. Okay, and to get that, you would just click on this Bite Integrative Peptides here, and when you check out, enter the coupon code. Okay, all right. All right. Good luck, Lynn. Can Lyme damage eyesight? Yeah, but I have found usually it's reversible. All right. So Lyme, one of the things it can do, it can infect the nerves that make your eyes work correctly. Not your optic nerve, but the nerves that make your pupils hold their shape and that help your lens hold its shape. Also, the nerves that make your eyes move, those can be infected by tick-borne infections, and usually that will recover. In addition, occasionally you can get inflammation of the optic nerve from tick-borne infections, and usually as you get that under control, your vision can go back to normal again too. Okay? All right. Hello, Joyce. Let's see. If you have time, I would be interested in your input on taking PQQ for mitochondrial dysfunction. Thank you. Yeah. So PQQ, everyone, is something called pyroquinolene quinone. I just love that name. Pyroquinolene quinone. And it is a substance that can promote mitochondria biogenesis, meaning mitochondria production. Okay. So it makes it so that your body makes more mitochondria and will also increase the mass of your existing mitochondria so that they can produce more energy for you. Where I have used it is it is a component of my favorite mitochondria support product, which is called ATP 360 by Research Nutritionals. The reason I like, and so what that product has in it, it's got a bunch of phospholipid fats. In addition, it's got a number of micronutrients that mitochondria use to work, like coenzyme Q10, NADH. And then in addition, it also has this pyroquinolene quinone in it, okay? The reason I like that product is it's not a one-shot fixes your mitochondria product. Rather, it's trying to address it from all angles. With the PQQ, it's dealing with mitochondria production and trying to increase mitochondrial mass. What the phospholipid mixes do with that ATP 360 is whenever you have one of the reasons that you can get mitochondria injury and mold toxicity, tick-borne infections, long COVID, is that there's an excess oxidation state created in the body when the immune system tries to deal with these invaders. It will dump out a lot of oxidizing agents like hydrogen peroxide, for instance, okay? And those oxidizing agents can damage fat membranes, including the fat membrane that makes up the covering of your mitochondria. If it gets injured, mitochondria do not function as well. All right. So a key component is not trying to promote mitochondrial mass. You still need to fix the damage to the existing mitochondria by using the phospholipid component that's part of that. Okay. All right. Good luck, Joyce. Hello, Lynn. Let's see. Also meant to say I have researched nutritional crypto plus. Do you prefer that over the plain crypto, or is this good or better, or how would you dose it for how long? Many thanks for all you do. So I tend not to like I tend to prefer using pure Cryptolepis over the Crypto Plus product. The reason is the Crypto Plus has crypto, but it has, I think, about 6 other herbs in it as well too. And I get concerned, and what I'm really interested in is that you get enough of the crypto in. To get the amount of crypto I would want you to have with Crypto Plus is you'd be taking a lot of excessive amount of herbs that you don't need. So I would stay with a pure crypto product, okay? All right. Hello, Mira. Let's see. Can Lyme cause white matter changes in the brain? And do you have a specific treatment related to symptoms like cognitive challenges? All right. So Lyme can give some white matter changes. That's not uncommon to see, but keep in mind smoking and being around smoke can give white matter changes. So not all white matter changes are necessarily from tick-borne infections. The radiologist that reads those MRIs should be able to say this looks consistent with Lyme or doesn't look consistent with Lyme. They usually will have some kind of a message in there about that. Okay. All right. And then in terms of cognitive challenges that are seen in Lyme, they have a few parts to them. Number one, you got to get sleep. So if you're not getting sleep, you need to do things to change sleep. I have a whole article, an updated article I made about sleep a number of months ago that really focuses more on lifestyle and things you can do with that you have control over to get sleep. Okay. I'll show that article to you here in a minute, but 7 to 9 hours of sleep is critical. Number two, lower the cytokines. And so be on something that lowers cytokines. So that would be my favorite again is the thorn curcumin phytosome, 500 milligrams 3 times a day. The reason you want to lower cytokines is excess cytokines lead to inflammation in the brain or are part of inflammation in the brain, lead to cognitive declines. Okay. Number three, you need to kill whatever your tick-borne infections are and go after them. All right. Number four, you want to support your mitochondria. So if you're not thinking well, it probably means your mitochondria are not functioning well. And what I like using for mitochondria is that ATP 360 I was just talking with you about, 3 pills 1 time a day. And for people that are really having challenges with thinking, I would add in some liposomal glutathione, and I would do the product I like for that is the Research Nutritionals product called Trifortify, and I would wind up doing a teaspoon of that at least 1 time a day. And then if you are really challenged still, I would look at adding in creatine monohydrate, so the weightlifter drug or herb or supplement. So what it does is it helps your mitochondria. So the reason weightlifters use it is that what it does is when your the fuel that mitochondria create is something called adenosine triphosphate, or ATP. When ATP gets used, it becomes ADP, which is adenosine diphosphate. So the difference between ATP and ADP is that you lose one phosphate, all right? Creatine monohydrate is rich in phosphate and it builds up inside your cells. And so when your ATP gets converted to ADP, it can grab a phosphate right away and recycle right back to ATP. So it's a way of keeping your mitochondria powered up, all right? Weightlifters use it because when they're weightlifting and you exhaust your ATP and you can recycle it really quickly. So they get more reps in and they can do more cycles so they can beef up more, okay? Now, if you're going to use it for brain health, you need to use it in a dose that will get into the brain. So muscles are very hungry. They're hungrier for creatine than your brain is. Muscles will basically grab the first 5 grams a day you have of creatine powder. If you want to get it into the brain, you need to be taking 10 grams a day, which often, depending on the product, is going to be 2 scoops, all right? The product that I like is a Thorne product called Thorne Creatine Monohydrate. You can find that through my partnership with Phimologist. They have it, all right? So those would be some things to think about. Additionally, you want to make sure that there aren't any toxins going in. So if you got mold toxins, that's going to create problems as well too. Okay, all right. And then finally, if you're under a lot of psychologic or adrenal stress, that can make it worse as well too. So you would need to deal with your stressors in your life. And let's see, eat an anti-inflammatory diet. In other words, a comprehensive treatment. Okay, so there's not one thing you're going to take that's going to make a difference here. All right. So let me do a screen share here. Okay, so in terms of sleep, let's go over here. Oops. Well, why? Hold on here a minute. can still see that. Let me try this again. Sleep. Right there. Okay, so take a look at my ultimate sleep guide for Lyme, tick-borne disease, and mold toxicity. Most of this has nothing to do with taking a thing for sleep, but rather what you should do in your life to make sure you've set the stage to get sleep. Okay? All right. Good luck to you. All right, let's see here. Hello, Deborah. Hi, Dr. Ross. Treated for Babesia, microcurrent, Bartonella, and chronic Lyme with atovaquone, cryptolepis, azithromycin, and doxy. I had symptoms for close to a year before I was finally diagnosed. I hit a plateau last month and was switched to phenequin, 300 milligrams each week after a loading dose, and continued atovaquone and doxy. Azithromycin was discontinued. Babesia symptoms are much better, but had a Lyme relapse after a knee injury. Is there a way to cover Lyme better? Also, is Babesia covered well enough admitting the azithromycin? So yeah, I think your Babesia is covered well enough. Basically, I use doxy and azithromycin interchangeably. They operate in a similar fashion and do the same thing in this treatment, okay? And you don't need to be on both. So a doxy, a atovaquone, and tafenoquine is a really good Babesia treatment. In terms of Borrelia, doxy is going to be good at treating growing spirochetes and also intracellular growing forms. Unfortunately, it doesn't do anything for persisters and likely is not doing anything for growing cyst form of the germ. I would suggest if you want to keep covering those, you might want to be on the cryptolepis still. Cryptolepis is useful for treating growing and persisting Lyme of all forms. It's also useful as an antibabesial agent as well too, okay? The dosing, if you want to use it mainly for its anti-Borrelia properties, would be a half teaspoonful 3 times a day. If you want to use it for its anti-Babesia properties, you would be taking a teaspoonful 3 times a day, all right? If you don't want to go back on crypto, if you're off of it, another option you could look at would be a liposomal cinnamon clove oregano. Is 1 pill twice a day, and that's a Dr. Essentials product. That product, or doctor-inspired formulations, I should say. I'm sorry. And it's called Liposomal Cinnamon Clove Oregano Essentials. That's what I meant to say. Anyhow, that product is useful at treating growing and or managing growing and persister Borrelia. It has the ability to remove biofilm on Borrelia as well too. And the clove that is in there has some antibabesial properties as well too. Okay? All right. Good luck, Deborah. Hello, Kelly. Let's see. Hi, Dr. Ross. I have a question with respect to Methylene Blue. My husband takes 75 milligrams of venlafaxine per day. And would taking Methylene Blue be out of the question due to serotonin toxicity? You'll have to talk to his doctor. All right. I want to be very clear about that. Do not do this without involving his doctor in it. But generally, what I do in my practice, and I think this is something similar to Dr. Horowitz when he has talked about it publicly before too, is that I will leave people on serotonin raising agents, but I want to make sure that they don't go over about that they use no more than half the recommended top dose. So for instance, Prozac, a top dose would be 80 milligrams. If somebody's taking 40 milligrams a day, I'm okay with that, okay? The venlafaxine at 75 milligrams per day is a lower dose of venlafaxine. and I would be okay, but you need to have his physician check and agree on this. I'm not your doctor and I don't know everything about him. I hope you hear all my warnings on that. But if it was me and if your husband, I would likely, although I would have to talk with him more to be sure, I would likely mix that venlafaxine at that dose with a methylene blue. Okay. All right. I hope you heard all my warnings around there, but yeah, I would do it. Okay. All right. Good luck, Kelly. Good luck to your husband too. All right, everyone. That's it. It's been good to be with you here tonight. I look forward to being with you again next week as well too. We have another webinar next week. Keep an eye out in your email tomorrow morning because you'll be able to sign up for next week. And I invite you to help me get more people involved here. So I like helping people. I spend quite a bit of time here with you each week, as you all know. And if I can help more people during the hour and a half, I would love to do that. So feel free to share my email tomorrow morning with people you think might be interested in what we talked about, but also share it with them to invite them to next week's webinar as well, too. Okay. I'm recruiting you to help me in my mission. All right. And so, yeah, take a look at your email tomorrow morning, somewhere around 9:30 in the morning. I should have that summary put together and with the synopsis and all the timestamps on the YouTube video. Okay. All right. Good night, everyone.